I'm going to talk about frustration,
Okay.
especially as the chronic fatigue got really bad. I was sleeping between 14 and 15 hours a day. That doesn't leave a lot of hours to do much else. And even though my husband knows I'm not lazy, he just like got to the point. He's like, you need to like do stuff around the house, and I'm just like, I can't. And I would really like to see some support groups for partners of or families of people with Lyme disease, because I don't, even though he has his own chronic pain, I tell him, I said, what you're experiencing and what I'm experiencing are two different things. And on the other hand, I have to think about what he says and weigh it a little bit. And you know, there's fear for me that I'll go out and I'll overdo it. And maybe I can do more than I can do. And although one of the things I really like, and I think it's really important, Dr. Sutter puts on her prescription sheet, she gives me one every month, and she says, do something once a week that you love. And I take it back to the leisure studies. I take that really, really seriously, that I need to get out and not feel like I'm sick. There's some things I can do. I was raised riding horses. I bought a horse. I see it once a week. If I can, and I have friends who will trailer the horse for me. I can't do it myself. I don't have enough energy to hook up a trailer, and I have one, but I can't use it. Anyway, but I can go on a trail ride for 2 hours, you know, at a walk up in the mountains, and it's really nice. And I don't think about Lyme disease once. It's just, so for me, like, horse day is sacrosanct. And then he says, well, I feel like I'm getting the seconds here. And I'm like, well, you kind of are. You know, he's right. But I also told him, I said, if I don't do those kinds of things. In the winter, I can ski. Tell anybody that. People that are sick shouldn't be able to do that. But I mentioned to you earlier, I was a ski instructor. I couldn't develop it as a new skill. But since I had so much skill, I can ski on beginner runs. The thing I have the most difficulty walking because of that hip injury. But if I stay on beginner runs and don't stay longer than 2 hours, I'm good. So I can get a season pass, ski at Park City. I went 9 whole times last year. I counted it up. I'm like, well, you know what? It's worth it. I get out. I get to be a real person. Nobody knows that I'm sick, and I'm just out there skiing, doing my thing. And to me, keeping that day, if there's nothing else I do during the week, to me that's like the most important thing that I do outside of continuing treatment. I consider that part of self-care. I think self-care has to be the priority of a Lyme patient, and I think it's very hard for people to do that. I'm lucky. I'm extremely fortunate that my children are raised, grown, not at the house. How people that have children do this, I have no idea. I have no idea. I mean, I can't even barely cook for myself. much less something a kid would eat. I can't stand at the stove for very long. So I want to cook something that I can have some leftovers and multiple things. What's lunch? A handful of nuts and half a bell pepper and a cut up apple. You know, so I just eat the same thing. When I go, that's my to-go lunch. If I'm home, like yesterday was I had a cauliflower I cooked the night before. Whatever is sitting around that's edible and fits in my diet as lunch.